Joining me to discuss is Mike Desjadon. He's the CEO of Anomaly, which is a healthcare software company streamlining payments between providers, payers, and patients. It's great to see you again.
Great to see you as well. Thanks for having
I'm
me.
glad we've pointed out that there's some industry-wide stuff going on here. Humana shares are also languishing.
Yes.
No one in this space seems to quite have the tailwind behind them that they once did. Is it all about Medicare Advantage, and is it all about maybe unwinding a program that, since its founding about 25 years ago, has become, I think, the #1 program? Is it United is about a third of total Medicare Advantage business, but most seniors now are on Medicare Advantage, not Medicare. So anyway, it's important what is happening with this.
Very much so, yeah. We've now, as a country, sort of tipped where 50% or more of Medicare beneficiaries are in some Medicare Advantage product offered by one of the carriers that you'd mentioned. And I think, it's real for everybody at the end of the day, because healthcare is so personal. And when you think about Medicare Advantage, the idea was we're going to take tax dollars and give them to commercial insurance companies under the trust that they will create the right environment and incentives to reduce the cost of care. Because as we know, U.S. healthcare is just run
And
away
how did
with
the
cost.
Opposite end up happening?
Lots of reasons. One, I would say complexity. But when you think about how care is delivered and paid for in the country, there are all kinds of incentives that are probably cross with what you and me, John Q. Citizen, would think ought to happen. So when you think about upcoding, for example, in Medicare Advantage, which I know was as part of the news stories today. And what upcoding really is, if you're an insurance carrier, is basically saying, hey, I've got this patient, Kelly's in front of me, and I'm looking at Kelly, and I need to get some level of reimbursement from the government to care for Kelly, and I get more reimbursement if Kelly is sicker. It costs more money to care for somebody that has more complicated health concerns, and that makes a lot of sense. But when you start kind of peeling back the onion and you start understanding how these organizations are proving that you are sicker than I am, for example, that's when it starts to get murky.
Right, and they get the money to cover potentially these, whatever might be going on with me, but it's not clear they ever have to disperse that, depending on my needs.
Well, it starts, let's say for the sake of argument, you're getting a Humira shot from a home health worker, and they come to your house to issue the Humira shot, and they're paying for that care. But they also notice you have glaucoma or some other thing, and they document that. That's not why they're there. That's not impacting your care. That's not what they're delivering to you, but it makes you look sicker, and they get, therefore, paid more, even though they might not pay for that care. I mean, that's a super basic example. But there are millions of these examples, and it's why Medicare Advantage, as per MedPAC, is $50 billion over what it looks like it should have been paid for Medicare. And when we are being taxed for those dollars and they're being given to commercial insurance companies, that doesn't look good.
And the Biden administration, as I understand it, was already trying to change some of the formulas here, and that was pressuring profitability for UNH and for some of the others. So there's only going to be more pressure on these programs. Now, we've heard from a variety of different people on Capitol Hill about this, raising the issue. The other part of this seems to be allegations in certain cases of kind of just chronically denying, to provide care. And so when you're kind of both upcoding and maybe making it super challenging to get these treatments signed off on, again, that's where, like you said, a lot of this goes. So should the company have ever been at whatever $600 billion market cap, it's shrunk by half.
Sure.
And so the big question, I think, for a lot of investors is it ever going to go back to the size that it once was?
Sure. Well, United will likely grow again. Medicare Advantage is here to stay, and it will likely expand. Although one of the things the administration has been very clear on is that the administrative bloat and or costs that's running all through healthcare is squarely in their crosshairs, and something that they are definitely going to do. And the plans are going to have to figure out, okay, I can grow my Medicare Advantage book of business and therefore the size of my company and my stock price. But if I have to pay faster and deny less all things that are in the crosshairs of United, I mean, these are things they're going to have to contend with. And, that's where companies like ours play. That's where, hopefully a lot of technology is brought to bear.
You're part of the problem for UnitedHealth also, or for, I'm
trying to be.